Now let's talk about the etiology of essential thrombocytosis. Essential thrombocytosis is essentially a diagnosis of exclusion. What this means is that there are numerous causes of thrombocytosis. A lot of common diseases can lead to an increase in the platelet count. So whenever we have a patient with a consistent increase in the platelet count on regular blood film examination or regular CBC, then it is very important to first rule out all the other causes, all the other common causes of relative thrombocytosis or thrombocytosis before arriving at a diagnosis of essential thrombocytosis, because it is one of the very rare types of causes of thrombocytosis. So let's first look at all the common causes of thrombocytosis, whether it's relative thrombocytosis or absolute thrombocytosis. The most common causes are any types of tissue inflammation, for example, collagen vascular diseases, or any types of inflammatory diseases like the inflammatory bowel diseases, the ulcerative colitis. They can all cause a relative increase in the platelet count. Similarly, a lot of malignancies can cause an increase in the platelet count. Infection of any type over a long period of time can lead to an increase in the platelet count. This is because a lot of inflammatory markers are released during the inflammatory process or during the infection, and they can stimulate the megakaryocytes to release a large number of platelets into the bloodstream. Similarly, the myeloproliferative disorders, all the types of myeloproliferative disorders have an increase in the platelet count. So it is very important to evaluate the other signs and symptoms in the patient and to look at the other lab findings to differentiate all of these types of myeloproliferative disorders. As in polycythemia vera, we have a very large increase in the RBC count. Along with that, the WBC count is very largely increased, and there is also splenomegaly. Similarly, in primary myelofibrosis, as we discussed in the previous lecture, there will be a picture of a bone marrow exam which is filled with all the reticulant fibers, and there will be also a massive splenomegaly. The cell count is variable in the initial phases of primary myelofibrosis compared to the later phases. Essential thrombocytosis, which is our topic of discussion today, it is also one of the myeloproliferative disorders. And similarly, CML, chronic myelogenous leukemia, can also have an increase in the platelet count along with the other features. So it is also the first step is to differentiate this essential thrombocytosis from the common disorders like some underlying infection, inflammation, or malignancy. And then afterwards, if we have ruled out those disorders, then we have to look at what type of myeloproliferative disorder are we dealing with. Is it a polycythemia vera or essential thrombocytosis or a CML? So we have to keep the important points of all the disorders in mind while we are arriving at a diagnosis. Similarly, certain types of myelodysplastic disorders like the 5q syndrome or the idiopathic refractory sideroblastic anemia, these are very rare causes of an increase in the platelet count, and the platelet count is not very much sharply or markedly increased in these cases. Splenectomy, post-splenectomy, or a hyposplenism. Spleen, basically what spleen does is it is one of the sources in which can basically store platelets in periods of stress. So if we have someone who has undergone splenectomy or whose spleen is non-functional, for example, someone who has had any abnormality of the spleen, for example, a splenic rupture or hyposplenism, then these patients, after the removal of the spleen, can have an increase in the platelet count, because the storage of the storage pool which was stored in the spleen has been removed now, and it is present in the normal circulation. Similarly, any type of hemorrhage can, for a short period of time, lead to an increase in the platelet count. Iron deficiency anemia is one of the very common causes of thrombocytosis. So if we have a patient who has no other signs and symptoms, and on the CBC examination, we are consistently getting an increase in platelet count, then it is also important to look at the iron stores of this patient and to evaluate the patient for iron deficiency anemia, as it is more common than the other types of other causes of thrombocytosis. One important thing to keep in mind is also that in most of these disorders, which are the common disorders, the platelet count is not very markedly increased. The platelet count is not in hundreds of thousands or in millions. If the platelet count is very markedly increased, like it is more than 1000 microliters of blood, then it's more likely that we have a myeloproliferative disorder. In all the other types, which normal platelet count is about 150 to 450 microliters of blood. So in most of the common causes of thrombocytosis, the platelet count might be greater than 500 or about 5 to 600 microliters of blood. But in cases of malignancies or in cases of the myeloproliferative disorder, specifically in essential thrombocytosis, it can be more than it can be in the level of the millions as well. So that also, the platelet count is also very important to compare it from a previous CBC picture which we have. Similarly, after surgery, a few patients can have a variable thrombocytosis, rebound thrombocytosis, especially if we are correcting a B12 or folate deficiency, or if we are post-ethanol abuse as an alcohol abuse. This is also a common cause of essential thrombocytosis. So it is also important to keep in mind the nutritional history of the patient, specifically if the patient is undergoing treatment for the deficiency of these vital minerals. Hemolysis of any kind can lead to an increase in the platelet count. And finally, certain familiar rare disorders like thrombopoietin overproduction or the MPL mutation. These are very rare disorders, and you have to do a genetic examination for these patients. And they generally present earlier on in the patient lifetime. So this list is basically a very exhaustive list of thrombocytosis. And the purpose of this list and to put it here is to just explain to you that essential thrombocytosis is one of the very rare causes of thrombocytosis. So whenever you have a patient with unexplained increase in the platelet count, it is very important to first rule out the common causes, and then finally, if we are not able to find out the underlying pathology, then we have to think about the rare disorders like the myeloproliferative disorders or the myelodysplastic disorders.